I'm not positive when everything did start because I've had a long history of mysterious symptoms that could go back anywhere from 10 to 15 to 20 or more years. But everything culminated about 7 months ago when I began to get very sensitive to sound, all noise entirely, that I had to wear earplugs whenever I was around anybody or anything. And there was nothing that I could do to try to lessen the severity or the intensity or the shock that I would get from any noise. And so 7 months ago is when things came to a major issue for me. I had to go to work with earplugs in, and I'm a school teacher. So it was very difficult for me to try to interact with my students as they'd be asking me questions from the back of the room, and I'd have to walk up next to them and say, what did you say? Because otherwise, just hearing their normal voices was so overwhelming to me. Um, Even being around my family, which I have three young children, became impossible. It got to the point where I had to move out of my house. I spent 2 months away from my kids, and eventually I even ended up having to spend some time in living in a closet because even the weather outside, the wind rustling up against windows was too much for me to handle. Going to the Aspirus Tick-Borne Illness Center was the first time that I met with anybody in the medical field who said that, yeah, your symptoms actually match. Your uh, crazy sensitivity to sound, your headaches, your migraines, your traveling joint pains, your changing in your blood levels, your markers in your blood. These all line up with a long history of your symptoms with tick-borne illness. And so let's try it out. Let's try to treat slowly, carefully. And within 2 months, I was already getting better enough to be able to go back to work, to be able to move back into my household. Working with the Aspirus Tick-Borne Illness Center has been an absolutely amazing experience because the team there is so supportive. They are easy to get a hold of. They were quick to respond to everything, every question that I had, every concern that I had. They worked with me about having fear about being on certain medications. And so trying to start them at lower doses or allowing me to choose from which things that I was most comfortable with. And they're very mindful of wanting to help me ease and transition into things to make sure that I was responding okay. And I continue to feel extremely optimistic and thrilled to be working with them. There's one thing that I would add. It's that I hope that we can continue to advocate that conventional medicine can accept that Lyme disease is not only real in an acute setting, but in a chronic setting, and it is responsible for so many mysterious illnesses that unfortunately so many people have suffered for so long, and that I hope that there can continue to be breakthroughs in progress to be better accepted so that patients with crippling and undiagnosed symptoms can try to get some help and relief.